prostate can swell silently, and most men over 50 don't even know it's happening until it causes constant urination, interrupted sleep, and even intimacy problems. But what if I told you that surgery is not your only option? In fact, some doctors are now shocked to discover that 3 inexpensive vitamins, yes, vitamins, can actually shrink an enlarged prostate and restore bladder function naturally. And the best part? These are readily available in your local pharmacy or health store. No prescriptions needed. Stick around, because in today's video, we're diving deep into the top 3 proven vitamins that can help reduce prostate size, improve urine flow, and bring back control, especially for men over 60. We'll also reveal the science behind each vitamin, food sources to get them naturally, and how they work in harmony with your body's needs. So if you've been waking up 3 to 4 times a night to urinate, struggling with weak flow, or worried about prostate surgery, this video is for you. And after watching, please leave a comment below. Have you or someone you know ever dealt with prostate issues? Your story could help someone else. Before we get started, do well to hit the subscribe button so you don't miss powerful health tips like this. If you've done that, let's get started. So what exactly is an enlarged prostate? It's a condition medically known as BPH, benign prostatic hyperplasia. BPH is non-cancerous, but can still dramatically reduce your quality of life. As men age, their prostate, which is a small gland below the bladder, starts to grow. This growth can squeeze the urethra, the tube that carries urine from the bladder out of the body. That's why so many older men experience frequent urination, especially at night, difficulty starting or maintaining urine flow, a weak stream, the sensation of incomplete emptying, in some cases, dribbling or leaking. According to the National Institute on Aging, about 50% of men over age 60 have BPH. By age 85, that number shoots up to 90%. The most common solution offered? Medications or surgery. But new studies now show that certain vitamins, when taken consistently, can shrink the prostate naturally, reduce inflammation, and restore urinary control. Let's explore the top 3. Vitamin number 1. Vitamin D3, the inflammation fighter. Yes, this sunshine vitamin is one of the most powerful weapons against an enlarged prostate. Here's why. Vitamin D3 helps regulate your immune system and reduce chronic inflammation throughout the body, including in the prostate. A study published in the Journal of Clinical Endocrinology and Metabolism found that low levels of vitamin D are strongly associated with higher prostate volume and increased BPH symptoms. In other words, the lower your vitamin D, the bigger your prostate can grow. How it works? Vitamin D3 helps suppress pro-inflammatory cytokines. These are like chemical messengers that tell your prostate to swell. By calming them down, vitamin D3 helps shrink and stabilize the gland. In a 2018 randomized clinical trial, researchers found that men who supplemented with vitamin D over 12 months saw a significant reduction in prostate volume compared to those who didn't. And get this, some men reported up to a 50% improvement in urination symptoms. How to get it? Sunlight. Just 15 to 20 minutes of midday sunlight can trigger your skin to produce vitamin D. Foods. Fatty fish, like salmon and sardines, egg yolks, fortified dairy. Supplements. For seniors, most doctors recommend 1,000 to 2,000 IU per day, especially if you live in northern climates or get little sun. Pro tip. Look for vitamin D3, cholecalciferol, not D2. D3 is better absorbed and more effective. Vitamin number 2. Vitamin E, specifically gamma-tocopherol. Vitamin E is more than just an antioxidant. It plays a crucial role in prostate health, especially when it comes to reducing size and inflammation. But here's something most people don't know. Not all vitamin E is created equal. There are 8 types of vitamin E, and gamma-tocopherol is the one you want for prostate support. In a 2010 study published in the American Journal of Clinical Nutrition, researchers found that men with higher blood levels of gamma-tocopherol had significantly smaller prostate size and fewer urinary issues. How it works. Gamma-tocopherol helps trap and neutralize nitrogen-based free radicals. These are particularly harmful to the prostate and can contribute to cellular damage and swelling. It also helps suppress COX, 2 enzymes, which are heavily involved in chronic inflammation. In simpler terms, it reduces inflammation and protects prostate cells from oxidative stress. Here are foods rich in gamma-tocopherol: walnuts, pecans, sesame seeds, pistachios, corn and soybean oils. However, most vitamin E supplements only contain alpha-tocopherol, not gamma. So if you're supplementing, look for a full-spectrum vitamin E complex that includes gamma-tocopherol. Dosage tip: 200 IU per day of mixed tocopherols is a good starting point. Always speak to your doctor before starting any supplement. Vitamin number 3. Vitamin C from natural plant sources. Vitamin C isn't just for immune support. It plays a major role in collagen formation, tissue repair, and prostate gland health. In fact, research shows that vitamin C helps reduce oxidative stress in prostate cells, supports detoxification, and may even inhibit the growth of abnormal cells. In a study published in the Journal of Urology, high intake of vitamin C, especially from natural food sources, was associated with reduced risk of BPH and fewer urinary symptoms. How it works. Vitamin C acts as an antioxidant, shielding your prostate from damage caused by toxins, aging, and chronic inflammation. It also supports capillary health, helping improve blood flow to the area. More blood flow equals better healing equals less swelling. Best sources of vitamin C. Bell peppers, especially red and yellow. Kiwi, papaya, citrus fruits. Strawberries. Guava, one of the highest sources. Camu and acerola cherry, super rich powders. Avoid synthetic vitamin C made only with ascorbic acid. It's not as effective. Instead, go for vitamin C from whole food concentrates or dried powders. Recommended intake: around 500 to 1,000 milligrams per day from food or natural supplements. Bonus tip: taking vitamin C with bioflavonoids, like rutin or quercetin, enhances its absorption and anti-inflammatory power. Now, these vitamins are powerful, but they work even better when combined with smart lifestyle changes. Here are a few simple habits to maximize your prostate health. 1. Cut back on red meat and processed dairy. These can increase inflammation. 2. Eat more cruciferous vegetables, like broccoli, cauliflower, and kale. They help detox excess hormones. 3. Stay hydrated, but limit fluids 2 hours before bed. 4. Avoid caffeine and alcohol before sleep. They irritate the bladder. 5. Walk or stretch daily to improve pelvic blood flow. And of course, regular checkups with your urologist are essential. Let's recap the 3 top vitamins that can naturally shrink an enlarged prostate. Vitamin D3 reduces prostate inflammation and may shrink size. Vitamin E gamma-tocopherol protects prostate cells and reduces oxidative stress. Vitamin C repairs tissue, improves circulation, and lowers BPH risk. These are safe, affordable, and available at your local health store. No surgery required. So if you're over 60 and tired of constant urination, interrupted sleep, or bladder discomfort, try incorporating these vitamins into your routine. Over time, your prostate may thank you. And remember, your health is your wealth. Don't wait for surgery to take control. Now let's hear from you too, dear friend. Leave a comment below. Have you or someone you know ever dealt with prostate issues? Your story could help someone else. Thank you for watching. Share it with someone who needs better health. And if you're over 60 and serious about aging well, staying independent, and protecting your health, subscribe to our channel. We've got more videos coming on how to protect your body, your brain, and your quality of life naturally. Don't go yet. Check out our videos on your screen and rebuild and maintain a better health before it is too late. Stay strong, stay healthy, and stay young at heart.